This short video contains important information about your upcoming minor skin operation. Minor skin surgery is a small, low-risk operation to remove something abnormal known as a lesion from your skin. This is usually done to relieve pain or discomfort, but sometimes can be done for other reasons too. What should you do before the procedure? You must not shave or remove any hair from the area being operated on, as this can increase the chance of infection. Your surgeon will safely remove any hair on the day if required. You must not stop any medication before your procedure. If you're taking medicine to thin your blood, please let the surgeon know on the day. You should plan how you're getting home and consider if your operation will affect this. For example, if we are operating on your fingers or toes, then you might find it difficult to drive home afterwards. Ideally, you should take a bath or a shower on the day of your procedure. Try to have a good meal before your procedure and don't skip any meals on the day. If you are a smoker, you should try and stop smoking, but if you're unable to do so, then even stopping smoking on the day of the procedure can reduce the risk of infection. What you can expect on the day. After you arrive, the surgeon will confirm with you exactly the operation we are doing, what it involves, and why we are doing it. You may be required to remove some clothing so that the lesion is easily accessible. The surgeon will then spend a few moments assessing your lesion. They may use a surgical marker pen to mark the area of skin that they plan to remove. You will be awake throughout the entire operation. You'll be asked to lie down on the couch and remain as still as possible. To numb the area, some local anesthetic will be injected around the lesion. This injection will feel like a small sting, but will only last a few seconds. After this point, your procedure will be totally painless. You will, however, feel pushing and pulling, which may be uncomfortable, but shouldn't be pain and is completely normal. Most surgery requires stitches to close the skin and to stop any bleeding. Depending on the procedure, your surgeon may use stitches that have to be removed after a few days, or they may use stitches that are left in place and dissolve over time. Your surgeon will let you know whether the stitches you have need to be removed or not. Finally, a bandage or dressing may be used to cover the operation site. The entire procedure takes only 20 to 30 minutes, or sometimes longer if it's a bit more complicated. Any lesion that is removed should then be sent by the surgeon to a laboratory for analysis. This is an important step because it allows the surgeon to confirm that the diagnosis of your lesion was correct. What should you do after the procedure? If your stitches need to be removed, you should be given an appointment for this before you leave the clinic. Your surgeon should give you a few dressings to take home with you. They should give you instructions on how to change your dressing after a few days. Unless you have been given specific instructions otherwise, you may shower 24 hours after your procedure. Simply remove the outer dry dressing, shower as normal without rubbing, pat dry with a towel, and then replace the dressing. Under no circumstances should you bathe or submerge the wound. Unless you've been specifically told otherwise, you can return to normal activities straight away. However, we suggest using a bit of common sense. You should avoid heavy activities or exercise that might put stress on the area for at least a week. Under no circumstances should you swim or submerge the wound in water. What are the risks of this procedure? Minor skin surgery is a very safe procedure. However, there may be some common or potentially serious complications that you should be aware of. There is a 100% chance that this procedure will leave a scar. The size and width of the scar is variable and will depend on many factors: the lesion being removed, where it is on the body, and how well it is looked after afterwards. If you've had problems with scarring in the past, then you should make your surgeon aware of this on the day. There is a small risk of blood leaking from the operation site. If this occurs, you should be able to control this by applying 10 minutes of continuous pressure to the wound. This pressure is just enough to make the top of your fingers turn pale when pushed. If after 10 minutes this does not stop the bleeding, then you should contact your surgeon or local healthcare provider. Rarely, a wound can become infected a few days after the procedure. Signs of an infection include the area becoming red, warm, or tender. If this happens, please contact your doctors, as you may require a course of antibiotics. Remember, following the post-operative advice will lower the chance of any of these complications. Your clinician will be happy to discuss these general risks or any specific ones to this procedure prior to your appointment. Once you are happy with all the information that you've received and are confident that you have no more questions, you may be asked to sign a consent form. We look forward to seeing you for your minor operation.